How to prevent breast implant complications. When considering breast implants, understanding how to minimize potential issues is key to a successful outcome. Preventing complications involves careful planning before surgery, precise technique during the procedure, and attentive care afterward. Starting with preoperative measures, patients should thoroughly clean their skin with antibacterial solutions to reduce bacteria that can cause infections. Surgeons often give antibiotics during anesthesia to further lower infection risk. Choosing incision sites wisely is important. Avoiding cuts near the nipple-areolar complex helps limit bacteria from breast ducts. Surgical techniques that reduce tissue trauma, like subfacial or dual-plane approaches, also help prevent complications. During surgery, the implant pocket is usually irrigated with antibiotic solutions or saline mixed with antibiotics to keep bacteria away. Surgeons change gloves, instruments, and drapes before placing the implant to avoid contamination. Using nipple shields and implant insertion sleeves can protect the implant from bacteria during placement. Handling the implant gently and minimizing repositioning also reduces trauma and contamination. In the immediate postoperative period, close monitoring is essential. Watch for signs of bleeding such as hematoma, fluid buildup called seroma, or infection. Early detection and treatment of these issues can prevent further problems. Patients with risk factors like obesity, diabetes, smoking, or previous radiation therapy should discuss these with their surgeon beforehand, as they can increase the chance of infection. If infection develops, antibiotics and sometimes surgical cleaning may be needed to save the implant. Long-term prevention focuses on regular follow-up visits to check implant integrity and breast health. Patients should be aware of any changes like swelling, pain, or unusual appearance and report these promptly. Maintaining a healthy lifestyle supports immune health and may reduce systemic complications. It's also important to understand that implants can rupture over time. Saline implant ruptures are usually obvious because the implant deflates, but silicone ruptures can be silent and might requiring MRI or ultrasound to detect. The Food and Drug Administration recommends periodic imaging starting 5 to 6 years after implantation to monitor for silent ruptures. Most patients will need revision or removal surgery at some point, either for cosmetic reasons or to address complications. Regular checkups help determine the best timing for these procedures. Overall, preventing breast implant complications involves a comprehensive approach. It starts with proper patient preparation, continues with meticulous surgical technique aimed at reducing bacteria and tissue trauma, and includes vigilant postoperative care and ongoing monitoring. Working closely with a qualified plastic surgeon ensures that any issues are caught early and managed effectively. Remember, each person's experience is unique, so personalized medical advice is always the best course of action. Following these guidelines can help you enjoy the benefits of your breast augmentation while minimizing risks and promoting long-term satisfaction.